Okay, so there's no doubt we are living through a massive psychedelic renaissance, right? Things like psilocybin and MDMA are being talked about as these incredible breakthrough treatments for some of the toughest mental health challenges out there. And it's all incredibly exciting. But as this whole new frontier of medicine opens up, a really critical question is starting to surface. Who actually gets to access these potentially life-changing therapies? And, maybe even more important, who's being left out of the research that is shaping what this future even looks like? That's the real tension we're going to dig into today, using a pretty groundbreaking study as our guide. So first, let's just get this straight. The promise here is huge. I mean, we're seeing clinical trials with just remarkable success stories for things like severe PTSD and depression that just won't respond to anything else. But when you start to look a little closer at this renaissance, a really serious flaw starts to become obvious. Just look at this number. Over 80%. That's how many of the people in psychedelic research studies were white. This isn't just a little bit of an imbalance, it's a massive, massive overrepresentation that has basically defined the entire field so far. And what that really means is that we have this enormous blind spot. We are essentially building this entire new medical approach on data from a very, very narrow slice of the human population. And that's a huge problem, because the very communities who often carry a disproportionate burden of trauma and mental health struggles, they're being completely left out of the conversation. So, how do we start to fix this? Well, one group of researchers in Vancouver decided to try something totally different. Instead of just pointing out the problem, they went straight to a community that has been pretty much systematically ignored. And they asked a very simple but very powerful question. The people they focused on were a group of marginalized women who are navigating this incredibly complex web of structural challenges every single day. Over half of them are Indigenous, almost half are involved in sex work, and a staggering majority, 77%, carry the heavy weight of childhood trauma. I mean, these are the exact voices that are missing from all the mainstream research. So the researchers basically asked them, look, if you were dealing with things like depression, PTSD, or addiction, would you even be interested in trying something like psychedelic-assisted therapy? And the answer they got back was, well, it was pretty stunning. Almost half, 43%, said yes. Think about that. In a community that has every single reason to be skeptical and distrustful of the medical system, this shows a really profound level of interest and, honestly, an openness to new ways of healing. But a yes is only part of the story. The researchers were smart. They knew it was just as critical to understand the hesitation, to find out the reasons why the other 57% said no or I'm not sure. And their concerns actually give us a really fascinating window into their thinking. So yeah, not interested was the most common reason. But look at the next two. I need more information and I'm afraid of having a bad trip. This tells us something huge, that with better education and a real focus on safety, that 43% number could probably be a whole lot higher. And this is where the story gets even more compelling. The researchers didn't just stop at a simple yes or no. They actually dug into the data to figure out what factors in a woman's life made her more likely to be interested. And a really clear pattern started to emerge. Interest was strongly linked to having a lifetime mental health condition, a history of childhood abuse, and daily crystal meth use, which is often a way people try to cope with trauma. Oh, and having had a positive experience with psychedelics before also played a role. And this table here, it just makes the story crystal clear. Just look at the difference between the yes and no groups. 81% of the women who were interested had lifetime mental health issues, compared to just under 58% who weren't. The gap for childhood abuse is just as wide. And for daily crystal meth use, the rate is nearly 3 times higher in the group that said yes. It's unbelievable. So let's just pause and be really, really clear about what this is telling us. The women who are facing the most severe, the most compounded challenges, the very people that these therapies are supposedly designed to help, are the ones who are most open to trying them. The need is what's driving the interest. It's as simple as that. So, what do we do with this? This isn't just a bunch of numbers in a study. It's a roadmap. It's telling us exactly how we can build a more equitable, more effective system for psychedelic medicine, right from the very beginning. And the authors of the study, they're really direct about this. They say it's just not enough to open a clinic and offer the therapy. No, the entire approach has to be totally different. It has to be built around trauma-informed care and real-world structural support. Okay, so what does that actually mean in the real world? It means creating spaces that are culturally safe, especially for Indigenous women whose traditions have frankly been co-opted by parts of this movement. It means every single therapist has to understand the deep, lasting impact of trauma, and it means connecting therapy to the basics: housing, safety, and harm reduction services. You can't separate them. And that really leaves us with this final crucial question. This whole psychedelic renaissance holds so much incredible promise. But what this study shows us so powerfully is that without very deliberate, very intentional action, these breakthroughs are only going to serve the privileged few. The real challenge here isn't just about discovering new therapies, it's about building a system that actually delivers healing to everyone. And honestly, that's a challenge we just can't afford to ignore.